study the parasite biology itself in order to identify areas of vulnerability within the parasite biology that we can target with interventions. So that is one area, and that's why we're trying to contribute that in our effort to eliminate malaria. So the other part I work on is the parasite-host interaction, and especially in the context of decline in malaria, because we've observed that with time, malaria has been declining, and the interaction between the host and the parasite also changes with the decline of malaria, because as malaria declines, also the anti-malarial immunity within the population also declines, okay? And that changes the interaction between the host and the parasite, and also the potential clinical outcomes. So we're trying to study this at both the parasite side and also the host side, the impact of this decline, this interaction in this context on the parasite and also on the host. So what we find is that as parasite decline, as the transmission declines, the parasite's potential to transmit increases. I think it's a kind of a counter. And what that means in the context of malaria elimination is that as transmission declines, the interventions that are targeting to block transmission is becoming much more important, because we find that actually the parasite is trying to invest more in transmission. So that's actually one implication of the study we found. And also, as transmission declines, the parasite-host interactions become much more hostile, okay? There will be much more hostile relationship between the parasite and the host, in that any infection is likely to lead to much more worse outcome, okay? And therefore, the public needs to be much more vigilant as, you know, as we're trying to eliminate the parasite will become much more virulent. Therefore, that's very important that we put all our effort to ensure that it's eliminated. Our study actually informs public public health and policy, in that as malaria declines, our effort to develop interventions that target transmission stage of the parasite is becoming much more important, as the parasite will try to fight back by increasing its potential to transmit. Therefore, that's extremely important, and that's one, I think, public health important finding that we've made in our study. And the other aspect is that as malaria transmission declines, also as I said, the relationship between the host and the parasite become much more hostile, and therefore we are likely to see, especially during high transmission period like the rainy season, we are likely to see much more severe malaria, all infections likely to lead into either clinical or severe outcomes, and therefore we need to be much more vigilant and stop the infection from happening from the beginning. One thing I think the public can help in eliminating malaria is making sure that they use their bed nets, you know, the treated bed nets, especially during the transmission period like the rainy season. Making sure that they empty containers that are containing water, so that you stop propagating, giving room to where the mosquitoes can thrive. So these are small efforts and make sure once a child or someone becomes ill or feels some symptoms of malaria, they rush quickly to the hospital or the nearest dispensary so they get quick treatment. That also will contribute to the fight against malaria. We have to fight together, both from the research part as researchers and also from the public side, and make sure that all our efforts comes together and we eliminate malaria, hopefully. Yes, in the near future.